I'm Aaron Dean, and this is Advocate Today. Access to gender-affirming care can be a key tool to improving the mental health of trans people. That's according to a new report from scientists at the University of Melbourne. They found that reducing the wait period for gender-affirming care also lowered psychological distress called gender dysmorphia among transgender adults. The researchers also found a clinically significant decrease in depression. That included a more than 50% reduction in suicidal tendencies among study participants who didn't have to wait to start care. There is a systematic problem with access to quality care and health equity in America. Black mothers and infants face higher mortality rates compared to other groups, but experts say that we can all push for quality care for all. In the U.S., black infants die before their first birthday at higher rates than white infants. Black women die during or soon after pregnancy, more often than white women. And the life expectancy for those who are black is significantly less.
It's not just a race thing, but the race thing is real and it's consistent and it is rooted in the reasons that we recognize Juneteenth today.
Dina Chisholm researches health equity at Nationwide Children's Hospital. She says that while some progress has been made over generations, the U.S. still has a long way to go.
When we leave folks behind, we create a situation where not everyone has an equal opportunity for success in school, and not everyone has an equal opportunity for success in jobs.
Chisholm says that there are significant statistical gaps in health outcomes and healthcare access for the black community, those who live in rural areas, and for people who have a low income. To change this, she says that we first have to recognize the disparities, and after awareness comes action.
Identify where the ways we're doing things impact populations differently in a way that generates differential outcomes, and then figure out how to fix it.
Chisholm says everyone can play a role in making impactful changes to health for all, no matter their job.
You, the doctor, and you, the nurse, and you, the teacher, and you, the social worker, and you, the member of the community, are all part of what we can do to close that gap.
There are many misconceptions about sickle cell disease and those who have it, and many patients often experience this on a daily basis. But one PhD student at the University of Houston is taking a stand and educating others about the disease. I spoke with Andre Marcel Harris about what sickle cell is and his work in advocating for the intersectionalities of the disease. So, we're here to talk about sickle cell disease. Let's just jump into it. What is sickle cell disease?
Sickle cell disease, in short, is a family of inherited blood disorders that basically is characterized by a mutation in the red blood cells. This mutation causes red blood cells to be, instead of being round and smooth, red blood cells turn into where the name comes from, sickle, into a sickle or banana or crescent moon shape. And when they do sickle, they're sticky and they get stuck in the blood vessels, and they don't last as long. They don't live as long. Average blood cells, I think, live 120 days. If I'm not mistaken, and sickle cells, I think, live maybe 10 to 20 days. And so that is the very basic explanation of what sickle cell is.
And you yourself, you've been very open on social media and all those things about your experience with living with sickle cell. Can you kind of tell our viewers what your day-to-day experience is like, and what are some of the misconceptions about sickle cell disease that people may think are true but really aren't?
So one of what I consider the pioneers in the sickle cell space, his daughter is also a pioneer in her own right, is a hematologist, a blood doctor, specialist that specializes in sickle cell. And she says something all the time, is that she believes that sickle cell patients are snowflakes. And we understand snowflakes to be just like fingerprints. They're unique. Every fingerprint is not the same. Every snowflake is not the same. And so I make that distinction to say there are hundreds of genotypes or different types of sickle cell, but even people who have the same genotype can experience sickle cell differently. So for me, I have the most severe genotype, which is what we call SS. And growing up when I was a child, I had a very hard time with the disease. Thankfully, I'm on a drug now that I've been on for almost 20 years and I take every day that has definitely modified the way that I experience my disease. So on currently on a day-to-day basis, it's more of me trying to manage fatigue, chronic fatigue, than it is to manage pain. But for a lot of us in this population, managing pain on a daily basis is basically how we manage our disease.
And sometimes you hear people say that they're having and correct me if I say this incorrectly, but a sickle cell crisis.
Mm-hmm.
What is that?
Yeah, I see you've done your homework.
I'm always prepared, okay?
Yeah, love that. Yeah, so sickle cell crises, in the medical terms, is called a vaso-occlusive crisis. Again, because sickle cell disease is a blood disorder, there's nowhere in the body that you don't get blood flow to, right? If it did not receive some type of blood flow, it would die. So if you think of it that way, sickle cell impacts from head to toe. There's no limb, no organ that does not get affected by sickle cell disease. So that is a foundation to explain that sickle cell crisis, again, can manifest in different ways for different people with different genotypes or even with the same genotype. But in a broad sense, sickle cell crisis is when those smooth red blood cells begin to sickle, and it's a process we call hemolysis. And hopefully those that end up watching this who are in the medical profession can nod and say, yeah, I got that right. I go to all these conferences and I learn the medical stuff because I'm a social worker. I don't know the medical stuff. But it's in a process called hemolysis, and that's really when the sickle cells sickle because there's a lack of oxygen. And so that is really where the pain comes from. The pain comes from the fact that the sickled cells are sticky and they get clogged into our tiny blood vessels. They scratch and they damage our vascular walls. And so a lot of people experience pain in different organs or in different parts of their bodies because of this sickling process.
So recently you made a social media post about the connection between the LGBTQIA plus community and sickle cell disease. You go on to say that there's a conversation that's not being had and things that are not known. What is that connection that you were talking about, and what's missing in this conversation?
And here's why it's important. And I'll use one post. Someone made a flyer, and I think this is what you were talking about a conversation we were going to have about, living with sickle cell, but also identifying it as LGBTQ plus. And, a lot of comments started coming in, and there were other sickle cell patients who were commenting, what does Pride Month have to do with sickle cell? And it really excludes the fact or ignores the fact, willfully or not, that people assume that sickle cell patients are monolithic, that we're all heterosexual. It bewilders me to think that people can think that our community is just homogenous. We're all different. These are the things why we need to study and understand sickle cell in its fullness, not just the homogenous side, not just the heterosexual side. We need to understand the people who live with this disease, who are LGBTQ, who may have same gender loving relationships or may have same gender loving sexual relationships, who, if they want to be safe, have the tools that they need to be that way.
And thanks for watching Advocate today. Download the app in the Apple or Google Play Store to stream us live, and you can subscribe to our YouTube channel. For the Advocate channel, I'm Aaron Dean.